challenges and recommendation. I am Mohammed Ilyas, who will be the MC for today's session. It is a pleasure to be among you guys, healthcare students and professionals across the globe. We would like to wish you all a Merry Christmas. We would like to reiterate how grateful we are for our partners, and collaborators for making this event possible. So before beginning today's session, I would like to present our speaker, Dr. Mohammed Hussein Amirzad Irana. Dr. Mohammed Hussein is a DDS and researcher in oral and maxillofacial surgery, medicine and pathology, founder of Universal Network and of interdisciplinary research in oral and maxillofacial surgery, UniORMS, an interest group in Universal Scientific Education and Research Network, USERN, in Tehran, Iran. He is also the head of department and research in ARCA Education and clinical research consultant. He is also an associate editor in BMC Research Note and Canon Journal of Medicine. It is worth also noting that he is a workshop instructor and mentor in research and fundamentals and methodology. I would like to welcome and give voice to Dr. Amirzad. Thank you for being here with us today.
Hello, everyone. Good times and Merry Christmas. Thank you, Mohammed Ilyas. I am Dr. Amirzad Irana, general dentist and researcher, as described by my friend Mohammed Ilyas. I am honored to present to you COVID-19 oral health challenges and recommendations in this session. Hope it will be useful. First of all, we have to speak about coronavirus and when it all began. On March 11, 2020, the World Health Organization declared the global spread of coronavirus disease 2019 or COVID-19 disease a pandemic. Severe acute respiratory coronavirus syndrome 2, or popularly known as SARS-CoV-2, which is a causative virus for coronavirus disease, is an enveloped positive sense single-stranded RNA virus which belongs to the Coronaviridae family. SARS-CoV-2 is the seventh coronavirus known to cause infection in humans. While severe acute respiratory syndrome coronavirus SARS-CoV, Middle East respiratory syndrome or MERS-CoV, and SARS-CoV-2 are highly pathogenic, which can develop life-threatening severe diseases that can result in death. Other species are associated with seasonal and usually mild infections. Three major pathogenic zoonotic disease outbreaks by beta coronaviruses have been seen during the past 2 decades. SARS-CoV caused a global pandemic in 2003 with an approximately 10% case fatality rate. SARS-CoV has not circulated in humans since 2004. MERS-CoV was first reported from Saudi Arabia in 2020 and has continued to infect humans with about 34.4% case fatality rate. SARS-CoV-2 is characterized by its rapid spread and virulent human-to-human transmission. Talking about the history of this disease, we have to ask the question that where are we now? Thanks to scientific efforts and vaccines developed by researchers, today approximately half of the world population are fully vaccinated. There are some suggested treatments, but still no definite cure was invented for this disease. But is it all? Also, SARS-CoV-2 is not highly mutable. Studies show that variants in the SARS-CoV-2 genome may arise rapidly and may have effects on the COVID-19 pandemic. Global tracking data clearly indicate that the SARS-CoV-2 viruses carrying the G640 variant in a spike protein spread faster than original D640 variant. The novel variant of the SARS-CoV-2 has been detected in the UK that is spreading rapidly worldwide. It has been noted that the spreading rate of the variant could be more than 70% of the cases compared to original virus. The UK variant has a large number of genetic changes. The novel UK variant does not cause more severe diseases than previously reported. Previously reported variants. It is considered that the UK variant will not affect the effectiveness of the vaccines. The South African variant and Brazilian variants appears to be more easily transmitted, and some vaccines may be less infectious against the novel variants. These all demonstrate that the pandemic will still carry on and worldwide precautions should still take seriously. We are still in a COVID-19 era, but how is coronavirus transmitted? Current evidence suggests that the virus spreads mainly between people who are in close contact with each other. For example, at a conversational distance. The virus can spread from an infected person's mouth or nose in small liquid particles, droplet or aerosols, when they cough, sneeze, speak, sing, or breathe. Another person can then contract the virus when infectious particles that pass through the air are inhaled at short range. This is often called short-range aerosol or short-range airborne transmission. Or the infectious particles come into direct contact with the eyes, nose, or mouth, which is known as droplet transmission. But why dentistry and dental procedures are highly associated with COVID-19 transmission? Dental professionals have been practicing increased infection control and taking universal precautions since the 1980s HIV epidemic. Nevertheless, oral health professionals are among those occupations at the highest risk for COVID-19. Dental care personnel face challenges because of their proximity to infected patients. These patients' mouths are open and unmasked during treatment, significantly increasing the potential for direct and indirect exposure to infectious materials. Two of the highest aerosol-creating procedures involve inventions that have been considered major advances in dental practice because they are faster and less painful for the patient. The two are, first, the high-speed handpiece with its water spray gland, and also the second is the ultrasonic scaler used by hygienists to remove hard deposits on the teeth, which are known as the calculus. These dental procedures have become problematic during the pandemic, providing an opportunity to shift to non-aerosolizing procedures and a greater focus on prevention. For better understanding the relation and association of coronavirus with dentistry, first we have to understand the oral cavity environment. The oral cavity, also known as our mouth, which we all know, is the first organ in the gastrointestinal tract. As we consume food, the first step is the digestion process begins here in the mouth as you chew and break down what you eat. Two types of digestion are taking place within the oral cavity: chemical digestion and mechanical digestion. Mechanical digestion happens as you chew the food and break it into small pieces. And chemical digestion takes place as your salivary glands add enzymes to the food for further breakdown. The main three parts of oral cavity are teeth, gingiva, or as public knows, gums, and oral fluids. Oral fluids such as saliva, sputum, are critical factors Despite their roles in transmission, which described earlier, oral fluids are biofluids that contain saliva and non-salivary elements such as gingival cervicular fluids, nasal and bronchial secretions, serum, and blood derivatives. Microorganisms, some cells and cellular debris, also exogenous substances. Biomarkers identified by different sample processes in oral fluids used for detection and diagnosis of significant number of diseases like cancers, autoimmune diseases, and also may serve for diagnosis and monitoring of SARS-CoV-2. As you can see here, this is a graphical abstract from one of our recent research projects, which published in American Journal of Infection Control. Some of the specimens derived from oral cavity and oral fluids could use this great sensitivity for detection of COVID-19. Okay. Knowing the history of COVID-19 era and also getting familiar with oral cavity, but what are the challenges during pandemics regarding oral health? The first issue is the oral health attitude and practice in public. Due to the highly contagious characteristics of the COVID-19 and the continued severe situation globally, mask wearing has become a part of our ordinary lives. We all use masks to prevent a transmission of COVID-19 to other people. The use of these masks has shown that many people brush less a day, and people are less concerned about oral hygiene, as it's described by Axelson et al. Oral hygiene may be considered as a social activity from individuals caring more about their public image than their oral health. Having nice breath, clean teeth, and beautiful smile are main outcomes of good oral hygiene, but sometimes good oral health is not the main aim, and social acceptance is the main goal. Due to this fact and high increase in face mask use every day, the oral health become less important. The decrease of toothbrushing frequency is associated with a higher risk of incidence or increment of new carious lesions in teeth. Moreover, this practice is important to maintain periodontal health or the gums health. Oral diseases such as dental caries, gingivitis, and periodontal infection may affect oral health and can lead to teeth loss. So the main and the first challenge is the oral hygiene attitude and practice, and the second challenge during this pandemic is the coronaphobia and avoiding dental treatments by individuals. Some people, which are not few, as I see in the everyday clinical practice, fear to get infected in dental settings. So regardless their teeth sensitivity or mild pain, they postpone their dental visits and treatment, which may cause other severe dental and systematic issues, and also more time and money consuming procedures to recover their health. When your teeth has some decays, it could treated in one session, very minor interventions, and also less money consuming. But when it gets to the root canal therapy or maybe extraction and implantation, is also more aggressive intervention, also may include some additional sessions for complete the treatment, and also, as you know, it is very money consuming. There is another question. Are there any other further challenges? We have to consider that the oral cavity is a mirror for whole body status and systemic conditions. So there are some other challenges during this pandemic which could affect dentistry and dental practice, as we will describe. First of all, gum diseases and coronavirus disease outcomes. Researchers discovered that COVID-19 patients with gum disease, I use the term gum disease for better understanding. The scientific term is periodontitis. 3.5 times more likely to admitted to the intensive care unit or ICU. So patients with periodontitis are 3.5 times more likely to be admitted to the ICU and 4.5 times more likely to need a ventilator, and also 8.8 times more likely to die when compared to those without periodontitis or gum disease. These results are according to the study of Marov et al., some researchers, I think in McGill University, and they added to that among those hospitalized with COVID-19, diabetes and cardiovascular diseases are two of the most prevalent underlying comorbidities, according to the CDC. Periodontal disease is associated with diabetes and cardiovascular disease. Also, causality is difficult to define because of the confounding evidence, and few randomized trials or longitudinal studies have been conducted to study this, but their association and correlation is significant, and we have to consider it as a main issue, the association of coronavirus disease outcomes and periodontitis. Another serious issue which I considered, I think many of our participants in this session are from India, so this issue may be important for you, is post-corona mucormycosis, or popularly known as black fungus. COVID-19 has been associated with a wide range of opportunistic bacterial and fungal infections. Both Aspergillus and Candida have been reported as the main fungal pathogens for co-infection in people with COVID-19. Recently, several cases of mucormycosis in people with COVID-19 has been increasingly reported worldwide, in particular from India. The primary reason that appears to be facilitating the mucorales spores to germinate in people with COVID-19 is an ideal environment of some terms. First, low oxygen due to hypoxia, high glucose due to diabetes, new onset hyperglycemia, or in steroid-induced hyperglycemia. Also, acidic medium due to metabolic acidose, diabetic ketoacidose, or DKA, and high iron levels by increased ferritins. The last thing that make the COVID-19 patients an ideal environment for black fungus or mucormycosis is the decreased phagocytose activity of white blood cells due to immunosuppression mediated or steroid mediated or background comorbidities. coupled with several other shared risk factors, including prolonged hospitalization, with or without mechanical ventilators, increase in mucormycosis in Indian context appears to be an unholy intersection of trinity of diabetes, rampant use of corticosteroids, which increases the blood glucose and opportunity fungal infection, and COVID-19, which causing the cytokine storm, lymphopenia, and endothelial damage. These results are from some recent research by Singh et al., which published in Diabetes and Metabolic Syndrome clinical research reviews. We talked about challenges. Now let's discuss the recommendations. There are some general recommendations for everyone, regardless the oral health status. First, get vaccinated when a vaccine is available to you. Stay at least 1 meter apart from others, even if they don't appear to be sick. Wear an appropriately fitted mask when physical distancing is not possible or when it's poorly ventilated settings. Choose open, well-ventilated spaces over closed ones. Open a window if indoors. Wash your hands regularly with soap and water or clean them with alcohol-based hand rub. And at least cover your mouth and nose when coughing or sneezing. Also, if you feel unwell, stay home and self-isolate until you recover. Also, there are some dental recommendations for different groups. First, the first group is corona-free asymptomatic individuals. The corona-free asymptomatic individuals with good oral health have to consider some general recommendations for oral health, such as brushing your teeth 2 times daily using a pea-sized amount of toothpaste. Avoid brushing with force because that can damage your gums. Floss your teeth at least once a day. Use mouth rinse after brushing and flossing to help eliminate any leftover particles. Limit sugary foods and drinks intake. Drink plenty of water throughout the day. Maintain well-balanced diet and avoid smoking. Also, you have to change your toothbrush once every 3 months. And the last item I have to add to these. Yes, we discussed that. Brush your teeth 2 times daily. Floss your teeth at least once a day. Use mouth rinse. Limit sugary foods intake. Drink plenty of water throughout the day. Maintain a well-balanced diet. Avoid the smoking. And changing toothbrush once every 3 months. Also, if there were no pandemic and lockdowns, we recommend to use routine checkups and regular checkings by the dentist, but it could be postponed during pandemic and lockdowns and for avoiding the transmission of the coronavirus. For individuals with following symptoms, such as severe pain, inflammation, severe sensitivity of the tooth, severe gum bleeding and teeth mobility, and also dental trauma, the treatment is necessary to avoid more severe conditions. So visiting a dentist is necessary at this stage. It should have been noted that these are all for pandemic situation and during lockdowns. For countries and cities which coronavirus disease is controlled and managed, there are no restrictions regarding dental visits and treatments. Also, the next group is symptomatic individuals. Symptomatic in terms of the coronavirus. When you have coughs and you have fevers and you think you are infected with coronavirus, You have, if you have a good oral health, it's recommended to you that you use the routine practice for oral hygiene as described earlier. Also, avoiding dental checkups until full recovery for avoiding transmission of the coronavirus to other, especially dentists and dental healthcare personnel. For patients with symptoms, for coronavirus symptoms, they have to visit hospital-based dental settings. So the next group are symptomatic. They probably have coronavirus diseases. Also, they have symptoms of severe dental conditions, as described earlier. Severe pain, inflammation, severe sensitivity, severe gum bleeding and teeth mobility, and dental trauma. They have to visit hospital-based dental settings, describing their situation and disease, and using high ventilated dental settings to avoid coronavirus transmission. So symptomatic individuals with following symptoms like severe pain, inflammation, severe tooth sensitivity, severe gum bleeding, and teeth mobility, and dental trauma, they have to visit hospital-based dental settings. The last group are the post-corona individuals. For high-risk post-corona individuals, as described earlier, they have to be aware of probability of getting mucormycosis or black fungus. So they have to use oral checkups to avoid mucormycosis to reach severe stages, which are lethal and may cause death. During pandemic, these groups are recommended to use the earlier described recommendations. And I think the last group, which are many, the post-corona individuals are in great risk of getting mucormycosis, possible in high-risk groups which have diabetes or using corticosteroids. So they have to be careful and use oral checkups and be aware of the oral signs and symptoms of the mucormycosis to avoid it getting to some end stage. During pandemic, we have to be more careful for us, or families and others. At the end of my presentation, I wish all of you a happy Christmas and wish healthy and joyful holidays for you and your families. I am available if there is any questions, and also I have to thank you for your kind attention.
Thank you, Dr. Amirzad, for the very interesting presentation. I invite all participants who are interested in asking questions in the chat box. So don't be shy, guys. We'll give you 2 minutes to ask your question, and that's it.
Waiting for our participants' questions, I have to add, during this pandemic, the awareness and educating others, as we know, is the key to overcoming this disease and these unfortunate situations. So I want to invite all of the participants in this session to use the sessions and also the recommendations I described, if they found it useful, and educate it and share it with their families and friends to help each other to overcoming this unfortunate situation.
We have a question here, Dr. Amirzad.
Yes, yes.
Yes. What is the age group most at risk to mucormycosis?
There are some controversial studies. Also, I am conducting a research project, meta-analyzing all of the case reports for mucormycosis. The high-risk age group is not definitive yet, but the high-risk situations such as diabetes, such as using corticosteroids, and also ventilators during their ICU admissions are the high risks for getting mucormycosis. So the age group is not definite yet, but others are definite, and we think that people with diabetes using corticosteroids and some underlying comorbidities are in great risk for getting mucormycosis.
Thank you. There is a second question. Is there any specific time period from recovery of COVID-19 infection and onset of symptom of mucormycosis?
Any specific time period for recovery of COVID-19 infection and onset of symptoms of mucormycosis? I have to admit it, I am not aware of that. Also, the studies are controversial regarding the times to diagnose the mucormycosis, but the first 2 months after coronavirus disease, getting in severe conditions and admitting ICU are great months to be aware and check up routinely for mucormycosis. If you have any families with diabetes or other comorbidities, also if they are getting over the 40s, please use some internet-based checkup routines and search for the signs and symptoms in the internet. And if you find that they are probably getting mucormycosis, please refer them to the closest oral maxillofacial surgeon. They will need some interventions, usually surgeries.
There is a third question. Yes, is there some racial? Yes, go on.
Racial predisposition, since it was mentioned that it's in the South Asia more commonly. The race, I think it's not dependent on the race of the individuals, but to the fact that the prevalence of diabetes and some underlying comorbidities are higher in South Asia. So it's not the causality, and maybe it's a correlation, but due to the fact that there is a great prevalence of diabetes in some Southeast Asia, also in Iran, some of our provinces and states are have some greater prevalence of diabetes. They reported mucormycosis.
There is a fourth question. Thank you, sir. There is a fourth question. Can we treat mucormycosis if we catch it early with a surgical intervention?
I have to say it's not in my field to speak about the treatments of the mucormycosis, but an oral surgeon oral maxillofacial surgeon will discuss this further. Also, I have to say, if you reach it in earlier stages, yes, it is probable to treat it without any aggressive interventions, such as surgical interventions, and it may cure with some medications. But it's not in my field of the study, and it's not in my field of research to speak about that. So please refer to an oral maxillofacial surgeon for further details and information regarding the treatment of mucormycosis. The general dentist will usually are the first line and the front line to diagnose. But the treatment is usually referred to the oral maxillofacial surgeons. I hope you find this information useful.
There is a fifth question. What about gender predisposition? It was seen more common among males.
Yes. I invite you to read my next research project article, which will, I think, publish during the next month. We are in the middle of the statistical analysis, and we use lots of cases from all around the world, and using to calculate the odds ratio and hazard ratio of different variables regarding mucormycosis and its outcomes. Yes, it's more reported in males, yes. But the gender predisposition is not clear yet. It have to be meta-analyzed. All right, I have to thank my friends in the students against COVID, and also my friend Muhammad Ilyas and my friend Chatoria for providing this opportunity for me and presenting this issue for you. I hope it was useful, and also I have to thank you for your attentions. If there are no other questions, I think we end the session.
Thank you, Dr. Emerjad, for answering our question. It has been truly an honor to host you in our session. We believe that the talk was very insightful for our participants as we learned more about all different challenges occurring in the field of the COVID-19 era. And we've noticed, like, from the question, that most persons were more interested in the mucormycosis. So we have, that was very interesting to see that there is young students interested in such pathology.
Yes.
Yes. So with this, our session has come to an end. For the participants, for the certificate, there will be a post-event form which has just been shared on the chat box. They will be sent there on the Zoom. So please do fill it up for the certificate by 12 a.m. Indian Standard Time. Kindly note that there will be no access to the post-event form after the meeting has ended. So please make sure you have access to the link. If not, revert back to us. So thank you. I will keep the session open for another 5 minutes in case you have any other question for the organizer. Then we will proceed to end the session. Thank you again, Dr. Mohammed Hussein Emerjad. It was an honor to be in contact with you for the last week. And we hope there will be more opportunity to work with you. Thank you.
Thank you.